overwhelmed by this idea of studying, it's because you're already thinking about the results. You haven't even done the work, but you're thinking about the results. That's like me, man. It's wintertime and I'm thinking about my summer body, okay? I want to fit into a cute little bikini, but I haven't been working out. Right? So it's overwhelming. Like, how am I going to fit into this bikini? I can't even get myself to the gym. Right? In order to make it easier for you, instead of thinking about the end result, like, oh my God, when I pass, right? Think about what it takes to pass. So what it takes to pass is chunk out your topics and cut them into bite-sized pieces, right? And so one of the biggest things about cutting that down also is then paired up with tip number 5, which is the order that makes the biggest difference. So I'm gonna give you an example. When I teach inside my 2-day manual therapy workshop, I do hands, wrist, elbow, and shoulder. And it's because I'm stacking the information. Because once you start learning about hands, well, the fingers and the hands sit on top of the wrist, right? And the wrist sits on top of the elbow, right? And then the elbow sits on top of the shoulder, right? So everything gets connected, and therefore it will make it easier for you when you're studying. So that's from a manual perspective, but the same is true when we are studying for the CHT. Now, CHT then has to dive it into other components. So for example, hands is a huge topic, but hands has tendons in it. So one of the things that I do is I talk about hands, wrists, and then tendons, because tendons is its own huge amount of information, right? So tendons then can be divided into flexors and extensors. So you have to really understand the anatomy in order to understand the protocol. How when you study in a particular order, it can really make all the difference in the world to make it easier for you. It is not an easy test. Obviously, anything that kind of labels you as an expert requires you to know some details and some information. So the exam can become it can be very technical, because when you're treating, it's also very technical, right? You have to know what to say to your patients. You have to know what treatment options you pick. And in the clinic, you can chuck a bunch of shit at the wall and hope that something sticks. But on the exam, they're saying there might be 4 different things you can do, but which one is the best one based on that scenario? So I'm running a free masterclass all on how to study for the CHT exam with ease, and we're going to talk very specifically about how to chunk out the topics. So I think when you learn and you chunk out the information, you learn and then you apply, you learn and then you apply. It just makes it easier. So anyway, I'm going to talk more about that. Sign up for my free masterclass and I'll see you there.